Hi, everyone. Thanks for joining First Focus on Children's webinar today. We're going to wait a few more seconds or another minute just for everybody to get in. Thank you. All right. Thank you for joining First Focus on Children for today's webinar. My name is Elaine Dalpiez, and I'm Vice President for Health Systems at First Focus on Children. You will also hear from my colleague, Avery Pakulis, at the end of this webinar. While we've hosted several webinars on the topic of mental health, this one is a bit different. Today's webinar was designed by teens and young adults, and it will be run by teens and young adults. Our panelists and our moderator have all had personal experience with mental health issues, but each one of them has used that challenging experience to turn it into something positive. Each of our guests is a dynamic leader who helps others and advocates on behalf of mental health for children, teens, and young adults. They have things to say, and they want adults to listen. But first, a few housekeeping details. We would like to thank our funders, who are the Robert Wood Johnson Foundation, the David and Lucille Packard Foundation, and the Annie E. Casey Foundation, for their continued support. And in order to give our panelists ample time to share their personal stories and policy recommendations within this 1-hour webinar, we will not have time to take questions from webinar participants or open up the chat function. However, we will share a summary of the webinar with everyone who registered, and we will post a link to the webinar on our website. So let's get started. To kick off the webinar, Senator Tim Kaine from Virginia would like to share some opening remarks. Senator Kaine is a member of the Senate Help Committee, which authorized the newly operational 988 Suicide and Crisis Lifeline. Senator Kaine is a longtime champion for children and youth. So let's hear now from Senator Kaine.
Hey everybody, Senator Tim Kaine here. It's my honor to speak to you all today about the nation's youth mental health crisis. I want to start by thanking First Focus for convening young advocates together to share your stories and experiences, because advocates like you inspire policymakers and propel change. As you know, mental illness is a silent epidemic that affects so many of us. I've worked hard to improve access to mental health resources. As governor, I worked to strengthen efforts to assist college students suffering from stress. And now, as a member of the Senate Health, Education, Labor, and Pensions Committee, the HELP Committee, we provided funding to launch the 988 hotline for mental health emergencies last year. We also, by doing that, allowed increased access to crisis support for those in immediate need. Data shows that the Virginia 988 Suicide and Crisis Lifeline receives an average of 6,000 calls every month. While that's great progress in expanding access to support for those in need, there's still a lot more that needs to be done. That's why I'm proud to support the Higher Ed and Mental Health Act, which I introduced with Pennsylvania Senator Bob Casey. This bill would allow the creation of an advisory commission to ensure states and institutions of higher education are provided with accurate information regarding the mental health concerns facing students. This data would help schools better support young people. I know these are challenging times, but I hope you remember that you're valued and that your advocacy has the power to help others experiencing mental health challenges and change the direction of our country for the better. Thanks for the work that you do in bringing awareness to youth mental health.
Thank you, Senator Kaine, for kicking off our webinar with such a positive and hopeful message. And we will continue working with you and your staff on mental health issues this Congress. First Focus on Children shares your belief that teens and young adults can change the course of our country for the better. And now I will briefly introduce today's moderator, Ms. Maddie Stultz. Maddie is a senior at Florida State University, where she is pursuing a degree in psychology. She sits on the national board of NAMI, the National Association for Mental Illness, and she wears many advocacy hats. Additional information about Maddie's bio can be found on our webinar invitation. So welcome, Maddie, and thank you for agreeing to moderate today's webinar.
Thank you for having me. Yeah, I'm excited to be here with such incredible young people, including all of the people that you see on this screen. I personally started my journey with mental health and to become a mental health advocate as young as, I believe, 15, when I first started dealing with symptoms of anxiety and depression. It was also the first time that I had gone to therapy, which is something that none of my peers were either doing or none of them were talking about, for sure. So it was definitely a journey that I unfortunately had to go through mostly on my own. But then, fast forward 3 years from then is when COVID-19 had finally begun, and that was the time of my senior year in high school. So it was a very difficult time to be so isolated from the support system that I had been able to cultivate over those 3 years of intense, therapy work. And it definitely exacerbated those symptoms, as I'm sure that it did for many young people. But it was also a time of a lot more reflection. And what you'll see here today from everyone that will be talking on this panel is that all of us have found ways to take that isolation and those symptoms and be able to, through reflection, turn them into tools to be able to help other young people that are dealing with similar things. So that was, a time for me to realize my passion for psychology and realize my passion for research, which I have much more explored throughout these 4 years of college. So, now that I'm about to graduate college in this spring, I am now pursuing a fellowship with the APA for research on perceptions of police and civilian interactions in young people. And I hope to continue to use this research that I am conducting now and in the future to use that as a tool for greater mental health advocacy. So that is a little bit about me. And I would be remiss if I took up any more time from these other panelists. So I will give you guys all a chance to go ahead and introduce yourselves. Martha, I believe you are the next one on my screen if you want to kind of give yourself an introduction to everyone.
Hi, everyone. My name is Martha Sanchez. I'm the Director of Health Policy and Advocacy at Young Invincibles. Young Invincibles is a national nonprofit advocacy organization focused on improving the well-being of young adults ages 18 to 34. And given that young people across the country are in a mental health crisis, this is a very strong focus for us. It's part of our policy agenda to make mental health more affordable and accessible for all young adults. But I'm here to share a lot about my journey with mental health, which started even before that. It started when I was in high school. I like that you mentioned about how this pandemic has made a lot of us reflect, because I think that as we spearhead this agenda of making mental health more accessible and affordable, I've had to reflect on my journey as a high school student and the things that I went through and moments in my life where there should have been better access to mental health. And we're looking at how we can change our, look at our stories and how we can make the stories different for other people, make them better. So when I was in high school, I was dealing with the grief of losing my mom to cancer back in middle school. And then about a few years later in high school, my father was diagnosed with cancer as well. And because we were a first generation immigrant family, I was the translator in my family. I was also the oldest sibling in my family. And like many Latinas, I took on a lot of responsibility in terms of taking care of my father, making appointments, being the translator of good news and bad news in those doctor's visits, taking just hold of the financials of the household, making sure everything was running smoothly. So much that no one really noticed in school what was going on until I asked permission to miss a few school days so I could donate some bone marrow to my dad. And that's when my counselor noticed, and she was just impressed because I was a 4.0 student. So I was not really offered any mental health support. And, you know, I did have my ups and downs in high school. And at one point, my teachers did intervene for me to, you know, get my grades together and graduate. But overall, I was a stellar student. And I think I held in a lot of grief and pain. And it wasn't until I was in college, when I was going through a really bad breakup, that I finally sought counseling, and my campus had free counseling. And so I started off receiving a free semester of therapy, which turned into a free year of therapy. And that was so healing and so helpful. And I was very fortunate that I was able to have, you know, that first just walk-in meeting with a therapist, where they were, you know, able to go through what was wrong and realize that there was something much bigger that was happening with my mental health. And since then, my journey with mental health has continued because, you know, just like there were barriers in high school, there were barriers in college of not having, you know, extended free therapy. I think we would all appreciate that. But then as a young professional, mental health is very expensive. Out-of-pocket co-payments range sometimes from $60, $90 per session. So if you have private insurance, it can also be very, very expensive to deal with, you know, a whole sorts of issues. And I think that I'm so glad we're having this conversation today because, you know, mental health is not just the moment that you are in crisis. We need crisis services, of course, but it needs to be a continuum of care. It needs to be whenever there's anything going on, at any age, at any point in your life, there should be, you know, readily and accessible resources out there. So I'm so glad that we're having this conversation today, and I'm excited to talk more about what good accessible mental health would look like for our generations.
So much, Martha, that when we'll come back to so much of that throughout this webinar. So I really appreciate it. Natalie, I believe you're next on my screen. So if you want to give yourself an introduction.
Thank you. I'd love to. Hello, everybody. My name is Natalie Clark. I use she, her pronouns. I am 24 years old, 25 next month. So I'm about to start calling myself 25. If I'm almost close enough, I want to say I am. I am from Salt Lake City, Utah. I have a long title. My title is the Lived Experience Transition to Adult Living Assistant Coordinator with Department of Child and Family Services. So that is just a long title for a young adult who's been through the foster care system. I spent 6 years here in Utah's foster care system. I help other young adults that are in foster care or have spent time in foster care navigate the resources and services that are available and exclusively available to them specifically because they were in foster care. I also use my lived expertise of spending multiple different periods of my life in the foster care system, experiencing foster care, proctor care, juvenile justice, substance abuse treatment, as well as group homes and traditional foster homes. All that lived experience from those different placements to help provide feedback on how to better improve the system to serve transition age youth so that youth that experience the foster care system don't all experience some of the same things that a lot of us that have been through the foster care system have also experienced. I have been an advocate with foster care for about the last 7 years. It all actually began when I was 15 also. When you said you were 15, that actually reminded me 15 was the year I started as a peer mentor. I would say that is really what kickstarted me into mental health. I spent a few years in a lot of different support groups and outside care, outside of residential, that really made a really big impact on me, and connecting with my peers and having that sense of connection that I wasn't the only person going through these things, and there actually was a support network that could guide me through it, and then I could also become that support network for other young adults, really has just catapulted me into somebody who loves advocacy surrounding foster care, mental health, and all of the other challenges that are very specific to transition age youth. So I'm so honored to be here and to be sharing this space with such incredible young adults. Thank you so much for having me.
Of course, yeah. I think that's one of my favorite parts about this panel is that we have all become experts on our own lives and, you know, the aspects of mental health and mental health policy that have affected us. So that's inspiring. And Trace, I think you're up next.
Thank you, Maddie. I just want to first say I'm just blown away at the incredible stories of strength and resilience from my fellow panelists. And it really is such a pleasure to share space with them and to be in this conversation. My name is Trace Terrell. I'm 19 years old, and I am a rising sophomore at the Johns Hopkins University, studying public health and writing seminars with an academic interest in how the narrative and poetic voice can be used to contextualize public health issues in the research to policymaking process. I hope to soon pursue a career in health policy and management, so so excited for that. And I, like my fellow panelists, really like to start by sharing my lived experience with mental health challenges. So from middle to early high school, I struggled with suicide, depression, disordered eating, and other mental health challenges. And I felt incredibly isolated and alone in my rural community, where conversations about mental health were non-existent and where access to care was so limited. And as a queer person, I felt unable to talk to the adults around me because I didn't see people like me as the school counselors, psychologists, or other mental health professionals in my community. Fortunately, this situation changed when I was able to volunteer with Youthline, a free, confidential teen-to-teen crisis help support hotline, my freshman year of high school at 14, not 15, but still in that same range. And this experience really launched me into the world of mental health activism and advocacy, because I realized through helping others for 3.5 hours each week that my mental health challenges were really a microcosm of these public health issues that affected hundreds of thousands of teens across the country. And it was really the knowledge that I wasn't alone that encouraged me to later seek treatment and then pursue a career in mental health. And I was able to then work with Active Minds, which is a national nonprofit with over 600 chapters on high school and college campuses, which are really just dedicated to changing the conversation about mental health and the ways that we talk about and seek care for it, and several of their high school initiatives and programs. And then had the opportunity to also help with the implementation of Oregon Senate Bill 52, also known as Addie's Act, in my school district, where I helped to allocate over $400,000 for new suicide prevention programs and trainings in my school district. And then kind of the culmination of all this experience, I was able to work really closely with my Senator Ron Wyden from Oregon to testify before the Senate Finance Committee about the youth mental health crisis. And through all of this, again, found this love for policy, and that's just the career and the space that I feel most comfortable in, and the one that I, as an advocate, feel that I can make a lot of waves in. And right now, I'm a summer intern with First Focus, where I work on their behavioral health portfolio, specifically in the areas of school mental health, peer-to-peer support, and adolescent crisis intervention. And also am a judge for the Child and Youth Resilience Challenge through the Department of Health and Human Services. And again, just so excited to share space with these incredible young people. I'm so blown away at their stories, and they inspire me each and every day to get up and do the work. So thank you for being you and for being here today.
Thank you so much, Trace. Trace is a great example of how these experiences can launch us into these incredible new careers and passions and focus on advocacy. So it always never gets old. That story never gets old. So Amaris, I believe you are last up, last but not least. So go ahead and let us know who you are.
Hi, I'm Amaris. I use she, her pronouns. I was a former youth in care, and my advocacy journey started really in high school, my junior year of high school, when I started organizing with other students in my like public schooling. We were talking about the suspension rate that was happening to young children and young Black children in elementary school. But I think my mental health journey really started at a very younger age. I think when I didn't have quite the language, and when my community didn't have the language for me. But I was a young, Black, fat, gay kid growing up in the hood, and so I think like a conversation around mental health really wasn't something that was intentional or something that was um, very made to feel comfortable. And so at a very young age, I think I felt isolated because of being gay and being a young kid who was experiencing gender euphoria. And I think I didn't have the language to explain that to my family or my parents. And so after going into care when I was 13, I think I was finally able to put voice to what I was feeling, and having such a strong support group and community was really helpful for that. And for myself, I saw such a difference in my interaction with people, and I was able to voice a lot of what I was feeling. But I think when you come from being so many years of being so silent, it is very, very hard to feel comfortable and to feel like you have space to voice that. And so it was important for me in my advocacy when I started in high school was to create space where youth were able to have intentional conversations about what we were facing and what we were seeing. I think it was easy for adults to see youth as that we are blind, I think, to what's happening in our world. And I think over these last few years, especially with these uprisings and with student organizing, we're seeing that youth are paying attention and that children are paying attention. We see the world, and it's really important for us to be a part of these conversations because we are adapting to this new world that has been given to us without choice. And we have to live here and we have to make community for ourselves. And so in my advocacy, it's been important to always shine light on the young children and like making sure that we're advocating for them and putting policy in place that allows for them to grow up in a world that sees them, that values them, that teaches them that there are different ways of thinking, that we don't have to look at mental health as a punishment or look at care as a punishment, but only as a tool to be something that uplifts you and that is able to make you go out into community and be able to voice yourself and be a person of advocacy. And so it's really been helpful for me to be a part of conversations like this, to voice and to be someone who is most affected by these problems, but having a seat at the table and also lending that that can be anyone else and that anyone can be a seat at this table. It is all about access and having the opportunity to do that. And so I'm very excited to have this conversation and be a part of this.
Thank you. That was very well said. And, just to say, before we really get started into the meat of this conversation, I am so thankful for First Focus on giving these voices to these young people that, we are able to make that seat at the table for ourselves. But there are so many others that are so much younger than us, so much, less prepared to do this kind of thing that First Focus is looking out for. So I really appreciate that. And you said it perfectly. So this is actually a really great segue into the rest of our Q&A because I think Amaris said it best. It's very hard for young people to take up space at certain times, especially when we have these intersections of our race and our class and where we were born and these mental health difficulties. So the first question I want to kind of open up to everyone is, what stigma have you faced as a mental health advocate, as a young person with mental health conditions? What have you noticed from your experience in those roles?
I'd be happy to kick us off for this question. I think as someone who has struggled with mental health challenges, I faced a lot of shame and isolation in my rural community where, again, these conversations about mental health were not had, and where there was only one mental health facility that serviced about 4,000 people in total. And I remember when I asked my parents that I wanted to seek care, I didn't want to be seen, and I didn't want people to know that I was struggling with my mental health. And I think that's in part because of men's mental health and knowing that it's really a behemoth in and of itself. And because when you're expected to be strong and stoic, but you're actually struggling, there's a lot of pressure placed on you. And to have it then further complicated by being queer and not seeing mental health providers who could understand my struggles, I just felt so incredibly alone and almost took my life because of it. But again, it was that sense of knowing that I wasn't alone and there were other people like me, and that there were conversations like this happening among my peers that really inspired me. And I would also say there has been stigma when I eventually moved into the advocacy space of not feeling like adults believed in my ability to make change. And I know that's something that some of the other young people here have said, but adults often undervalue the input and expertise and wisdom that young people can provide. And I think that was one of the biggest things I faced, because I was doing the work on the ground, but wasn't necessarily being seen or valued for the effort that I did and for everything that I was able to contribute.
Yeah, I would add to that. In my experience, there was a lot of generational stigmas that I was dealing with. So, like even today in my family, mental health is still a very new topic. But we know that among young people and young adults, it's mental health is becoming a very open topic. There's less and less stigma and more of a vocalized need for mental health. But then sometimes the adults are still, dealing with their own stigmas, and it can be generational, it can be cultural as well. Even religious, sometimes religion plays a factor where it's like, well, you're just not going to church, that's your problem. And so it's just rushed away. I think us getting to a point where family members, family units as a whole can embrace mental health, that would be the ideal and the goal. Because I think that's, it continues to be a generational struggle where young people are becoming more and more open because we're all feeling the pain and everything that COVID-19 exacerbated. But then it's, having the adults, the family members, but then also the policymakers and the providers listen and meet our needs. It continues to be a challenge.
Yeah, I fully agree with that. I think that both of you sort of talking about how there are so many struggles with a young person's life that sort of build on top of each other's. And, this happened to our parents and this happened to their parents, and they just continue to transfer that stigma onto us, and onto future generations. So unless we are able to break that cycle and that method of thinking, it continues. So we're doing a great step right now by breaking that cycle today. So I really appreciate you guys' answers and your knowledge on such a topic. So from your own experiences as advocates, let's talk about, the successes, the wins that you guys have had in raising mental health issues with policymakers, or even just successes you've had in the mental health advocacy space. What have these positive results been? And these can be, deliverables of very specific, policy changes that you've seen, or more abstract, changes in beliefs, changes in culture that you've seen.
Yeah, I can share first. When I first began organizing, I worked in Pittsburgh, and I was doing a lot of on the ground work. And a lot of it was with elementary school teachers and parents, and worked closely with the school board. A lot of what I did was local organizing because I felt it was very effective to like be organizing with people who it's going to affect like right there and then, and actually wanting to see some of those results implemented in my community. And so something that we wanted to be done in elementary schools from K to fifth grade was to eliminate suspensions for, things that weren't like high risk, things that weren't like, there were levels to things. And so like if it wasn't a level 4 or like even a level 3, like students should not be suspended for this, or having repeated offenses that build up to a suspension or to an expulsion. And so something we advocated for was that there has to be alternative ways for us to deal with behavior. There's be alternative ways for us to be able to talk to parents. And I think a lot of what we were seeing was that a lot of what has to happen was preventative. A lot of the measures that we need to be taking for these suspensions to not happen had to be preventative measures. But something that we wanted to see was that our babies weren't being suspended from school. And so we were able to work closely with students, parents, and school board members to actually implement a ban on suspensions for K through fifth grade students. And that was something that was a huge accomplishment because one, it showed students that we are advocating for them, that we're listening to them, and that we think that what's happening in schools is sometimes it's over policing. It is over policing our students. It's making them afraid to talk about their issues. It's making them afraid to come to school. And when you are isolated in a way that creates for so many days of suspension, you don't feel like you belong. You don't feel like you have a space in that classroom, and then your voice is not valued. And so, of course, you're going to become a repeat offender because what's the point of showing up? What's the point of participating? And so, I think it made a huge, it made a huge difference for our parents and for our students to see that they're not going to, that you won't be suspended, but there are alternative ways to talk to you. There are alternative ways to show up for you and to really advocate for you as a student. And so I felt really proud of that. And I think that is some of the work that has to continue for us to like be intentional about those preventive measures even before they get to our adult age of having these conversations. What can we do for them while they're in kindergarten, while they're in first grade, to create healthy conversations around mental health and around talking about feelings so that they don't feel isolated or scared?
I just want to speak to that just for a minute, that I really love that. And, you know, labeling is such a very important yet, you know, destructive thing to young people at times, that, you know, if you, even the younger that you are, and someone tells you what you are and how you are acting, and the repercussions for those actions that you continue to face, you know, kids as young as elementary school, like you said, K through 12, or you know, in the beginning of that, can start to think that they're a certain type of person that they haven't even become yet. You know, they haven't even, you know, become a full conscious, personality driven person yet. So I really appreciate that, and that work being done, because it's relevant to so much of what we'll talk about today. It can be seen in the foster care system. It can be seen in over policing of young people in general. So that's really inspiring.
Maris, I really love that you brought up such a heavy theme of prevention. I think prevention should be a first focus, first focus. But sorry, I just had to go in there with that. But I really think that should be a main priority focus, right? And one thing that I'd like to speak a little bit on is the Family First Services Prevention Act, because that's something that a lot of us with lived expertise were included on from the start in 2016 through 2018. And the importance of this legislation to allow services to be provided not just to the youth, but to the family, right? Because all of these issues that we're facing, again, the microcosms, they're not just impacting the young person. And it's great and fine to provide services to the young person, but if that young person receives all of these services and gets all of this assistance and help to grow, but then are then placed back with our family unit who has not received any service, any assistance in growing and getting the needs met that need to be met, then there's a disconnect, right? So I really love that focus on prevention, because young people deserve an opportunity to not get to our point when now is their first opportunity to even get access to counseling or some other type of service that fits their need, because counseling may not be the specific need that they have, right? But I think prevention should be a number one focus, and I really appreciate you mentioning that, Amaris.
I also want to jump in and share, along with that idea of prevention, also talking about how these policies affect people and how we can include prevention into that, right? And I'm happy to share a little bit about this really awesome opportunity that both Natalie and I were able to participate in a few months ago. And that was the first Utah Youth in Transition Policy Summit with the Center for Law and Social Policy, the Utah Department of Health and Human Services, and NAMI Utah. And it was a panel of 5 or 6 teens that really evaluated policies that affected the mental health of transition age youth across the country. And the really positive result from it was that we were able to provide some really concrete recommendations for improvement, and author a brief that was the kind of details all of the work that we did and everything like that, and which it should be shared now or in a little bit in the chat. But it was just such an incredible opportunity to show how power sharing can look and take shape and everything like that. And I also, along with that, right, I mentioned that I testified before Congress with my Senator Ron Wyden from Oregon, and I talked a lot about the youth mental health crisis, right, and the need for expanded peer support services and school mental health infrastructure. And we were able to secure some funding and some additional support for the legislative priorities in the committee at the time. But what I really want to stress is that involving teens into the policymaking process and having results come from it is possible. And the fact that it's 2023 and we still have organizations and lawmakers asking if it's possible is just such a disservice to the young advocates like us who are on the ground and doing the work. And I really just want to stress, if you want to know about youth mental health, ask youth, ask young people, invite teens to the table, and really make sure that they're involved and embedded in the legislative process.
Thank you. I would add to that. I think there there's so many ways to take this conversation from everything that's been shared. I think when we were, sharing about prevention measures, there's definitely, racial bias to how some students, some schools are approached about their behavior versus others. And then the privilege of being able to receive certain resources and the empathy with which you receive those resources. And I didn't want us to let go of that thought, because I think it's really important. And again, highlights what Trace just said about the importance of making sure that young people are at the center of how these policies are being created in terms of actually bringing mental health services into schools and onto campuses. On Young Invincibles, when we focus on transition age youth, we have a lot of youth who are going from Medicaid to private insurance for the first time, or they end up uninsured when they enter college, and so they are on a student plan. We've been able to, support their mental health needs through passing state legislation in Colorado and Illinois to fund public colleges and universities a little bit extra when they set standards of mental health resources. It's called a Healthy Minds Checklist. And so these are schools, public colleges, universities that agreed to abide by a certain standard of having, certain services at orientation that talk about mental health, having certain, resources available to students on their ID cards, or at a counseling center, having actually a certain ratio of student to counselor, so that students can actually find appointments for mental health on campus. We think that legislation at the state level was only successful because of the students that shared their stories about how those interventions and services are life-saving. And it's something that I think at the federal level, it would be really incredible if the federal government paid more attention to how do we support ensuring that, all K-12 and colleges and universities are meeting a certain standard of having mental health resources that are culturally competent to the communities that they serve.
I think it's so important that we share these achievements and these positive changes that we've already seen, because it shows that this model works. It shows that including young people in this conversation and I like what Trey said, this power sharing model, that it's effective and it has already contributed to so much change. And I think I can briefly speak to a little bit more of an abstract change in culture in mental health advocacy. I know that when I started a long time ago as a NAMI Tallahassee volunteer, I was maybe upwards of 30, 40 years younger than most of the other volunteers that were running NAMI Tallahassee. And while this was an incredible experience to be able to learn so much from my elders and from these people who have been doing mental health advocacy for their entire life, it was also a bit of an isolating culture to be able to be the only voice for an entire generation in my rural community. And so in moving up in the NAMI sort of hierarchy, the NAMI triangle, once I got to the national level and had worked with the NAMI Next Gen Youth Advisory Board, which was a group of 10, I believe it was 18 to mid 20s individuals, that was such a different feeling of having this community of people in the exact same space as me. And just seeing that change in culture, that now we're not only listening to, but also appreciating and acknowledging and taking advice from these young people on mental health issues has been so encouraging. And now serving on the board of directors in NAMI and being able to contribute to their policy decisions and their opinions on certain political issues, it has just been incredible to be able to have that seat at the table. So seeing that difference, even just in that short amount of time, is really encouraging. I want to get back a little bit to what Martha actually just spoke to, which is, having these oh my gosh, sorry, I just lost my words there for a minute, but having these resources for these young people, especially in the college level, is what I believe the most of us have experienced. But the state of Alabama recently just signed a bill into law mandating that all school systems have a mental health coordinator. And what this means is a mental health coordinator oversees a school's mental health programs and services and helps connect students to resources inside and outside of school. And I know you spoke already to your experiences in high school and how, that was this is an isolating experience and almost discouraging of seeing that lack of care. So I want to ask, how might this bill and this infrastructure that's now being built, how might this have helped you when you were in school and dealing with these mental health challenges?
Yeah, I think it's a bill that is so long overdue, and I'm happy that the state of Alabama has that, and I think it should be in every state and every county in the United States, because counselors make a huge difference in their ability to really guide students and provide support. And to have a counselor that's dedicated to mental health is super important. In my case, I wasn't completely alone. I had my high school counselor, Miss Benitez, who was one of two Spanish-speaking counselors in a school that was predominantly Latino and African American. So you can imagine her caseload was so heavy, and her main responsibility was to be an academic counselor. So yes, during lunchtime, I would go into her office and just, vent, and she would give you the time that she had. But she was, busy making sure that students were taking the right classes and meeting their graduation requirements, or writing letters of recommendation for college, and actually getting a lot of students that have never gone, from families who've never gone to college, into college. So she was really busy. And a lot of these counselors that we have today are really overwhelmed, and they're underpaid, and they're stressed, and they want to make a difference in students' lives, but it's just not realistic. There needs to be an intentional investment in mental health coordinators and counselors in the K-12 system. So I think, things like this is something that is, I applaud, and I hope that we make sure that as the federal government continues to invest in K-12 as well, that these investments are intentional in making sure that we have culturally competent mental health counselors in every school.
Yeah, fantastic. And speaking of that cultural competency, Amaris, I wanted to sort of gauge your opinion on this of, as we're increasing this policy for youth mental health care and making sure that this mental health care is equitable and equally accessible to everyone, how do we stay cognizant of these cultural differences and also the systemic racism that intrudes in school systems, in healthcare in general? How do we stay competent in those biases?
Yeah, that's thank you for that question, Maddie. I think it's such an important question and conversation to have, especially when young people are seeing lawmakers put actions and put legislation into works that are telling them that, being a young trans person is not normal. And when they're seeing states like Florida implement laws that were saying like slaves benefited from being in slavery, I think it's important to have those conversations that are honest and truthful, and that are intentional about this brutal history that we're living in, right? We are having youth who have graduated on Zoom. We have youth who started their freshman year in colleges. We have youth who watched, a president, be here for 4 years and spew hate and allow a community of people to come out and put their hate in such a public platform. We have people who are storming the Capitol. So I think it's important to have real conversations, right? And it's important that in these our differences is that language is such an important thing, right? And like when we're talking about mental health, it's even challenging the language that we have in this conversation. It's challenging our language because we don't all have shared language, right? We may come from some of the same experiences, but we don't have the same shared language. And so we cannot treat every single person who is dealing with something, or every single young person that's dealing with something, as the same. You're not going to get the same from Martha's school, from the school that I was going to. You're not going to get the same. Like it's going to be different, and how we're talking to youth and dealing with youth is going to be different. And so I think having people with lived experiences in these rooms when we're talking about policy, having people with lived experiences actually creating the language that some of these counselors are going to be using in their sessions. You know, you want people who have experienced these things and people who come from public schools, people who are coming from higher education, talking about really what needs to be implemented and focused on and talked about. And I think a lot about in policy is that it's hard to talk about policy because it is a very higher educational. It's scary. It's that language can be big and bold for a lot of people who don't understand that. While they may recognize that, you know, their friend is facing mental health problems at home and that it's because their mom has cancer and that they didn't have the health insurance to pay for that. While they know what that looks like, they don't know that that looks like medical racism. They don't look like their friend getting suspended is the school or prison pipeline, but they know that their friend is about to go to jail because they keep missing school. So like it's about having language and creating a space where youth can be so honest and so 100% transparent with themselves that allow for us to create policy that they can read and have access to. Because what is it if we're creating policy that they can't read? What is it that we're putting things into place that youth don't even understand? And they're the ones giving their voices and offering up their stories. And so I think it has to be intentional conversation and being able to have shared spaces.
Yeah, I like that. I like the idea of that language, because there's so many translations that we need to have in language. We're a completely different generation than ones past us in a way that has never been seen before. We have this unprecedented amount of access to all kinds of news at all times, and that affects all of us in the way that we talk about these things. I sometimes feel like me and my peers often talk about this lexicon of understanding and of cultural competency in a way that I have never seen mirrored by the adults in my schools, in my healthcare settings. So I really like that language aspect of things. I also the idea of taking up that space and being able to have that honest conversation. Being based out of Tallahassee, Florida, I am very much familiar with the sort of silencing and the censoring that we're experiencing, and it can result in a complete denial of, or even just unacknowledgement of, one's background, of one's history, of one's identity. And so you get these kids that are growing up that have no idea who they are, no idea where they came from. And we know already that history defines our identity and our sense of belonging. And, in other cultures, that is even more important than others, So I really appreciate talking about having that honesty. And I think that in policy, I think that's important, of reminding people in, the mental health field and also in advocacy fields to mirror that honesty and model that honesty so that young people have that framework in order to speak in that way. And going forward with that honesty and that ability to talk in a way that has that language to understand your own feelings and explain your own feelings. Trace, I wanted to kind of ask you about your lived experience and that of your peers, of what you've seen as sort of the biggest obstacle that young people face when they're trying to talk about their struggles in mental health. And how can we translate these obstacles in language or stigma or whatever it may be into policy-driven solutions?
Absolutely. I think that's a wonderful question. And I think the first point I would make is that a lot of teens and young adults feel like their mental health concerns are not valid or real. And this was something I encountered a lot while volunteering with Youthline, is that young people would reach out and say, I'm having, a mental health crisis, but do I really, am I taking up too much space by asking for support right now? And although there is a lot of work to be done, I think one of the best recent movements to address this is 988, right? Which really does level set mental and behavioral health with physical health. We've said for the longest time that if you are in a physical health emergency, dial 911 and you'll get a physical health response. And now we can say, if you are in a mental health emergency, dial 988 and you'll get a mental health response. And that's absolutely incredible. And I think in doing so, we really open the door for conversations about mental health maintenance and kind of this stage that's outside of this crisis framing. I think we often stress the importance of really routine exams for physical health and not so much for mental health. And so I think one of the ways that we could address this and really make sure that young people know that their mental health is valid, it's real, and that they are loved and cared for, and we want them to get the help that they need, is to really enforce the Mental Health Parity Act, which historically has not had a lot of funding or enforcement for it. And then also require like mental health checkups in schools and communities, and follow in the footsteps of Young Invincibles and advocate for some of those programs, and making sure that, you know, mental health care is as available as possible. And I think the second obstacle, stepping away from that, but the second obstacle at play here is really the lack of youth involvement in the policymaking process, because it is one thing to ask for youth feedback, and it's really another to create these long-term power sharing relationships with children and adolescents. I can tell everyone here right now that young people want to be involved, and they want to see themselves included in the legislative process, because we are truly, at the end of the day, policy experts and fiscal partners and stewards of our own lived experiences. And we want to see our stories heard, translated into action, and then be involved in that process. And so to really all the Hill staffers here and organizations and policy focused groups, I really want to challenge you to think about how you can embed teens in the drafting and the implementation and the evaluation of legislation through advisory or steering committees that really extend beyond these one-off panels or like feedback sessions or focus groups. We want to see ourselves in the process, and that involves thinking of us not as people who are helpless, but as people who are co-workers, and as people who are advocates, and as people who have done so much work in their own right.
And this, for everyone, you know, if this is sort of, if we compare this to taking notes for an exam, you know, this is something you want to highlight and star and, you know, underline, circle with a big pen. Like, this is what we're talking about in policy changes. We want parity for mental health. We want, you know, common and consistent mental health checkups, regardless of who you're dealing with. If you are a doctor that has been seeing a kid since they were, you know, a toddler, and they have never experienced any kind of mental health issue, you're still giving them those screenings, because you never know when that can show up in a child. So no, I appreciate that 100%. And we want that inclusion in advocacy. Absolutely. And so, Natalie, I wanted to kind of shift to you for a bit, because I know we're talking about these challenges that young people face in how they, you know, want to approach mental health care, how they want to, you know, even start that journey. And we know that foster care is a different beast when it comes to, you know, childhood and in general, like adolescence. And it's often an overworked and underregulated system, unfortunately. So what are some of the challenges or deficiencies in care that you believe should be in everyone's mind today as we work towards policy to increase that quality of care?
Yeah, absolutely. Thank you so much for asking that question. I really love this question so much. And I think one of the biggest pieces that I'd like to stress is avoiding the Band-Aid fixes, because like we've mentioned time and time again, these are all pieces of a larger problem. So we really have to target each piece individually in order to get a whole solution. So for example, one of the problems that I'm experiencing here in my state that I know is pretty common through other states is the lack of providers that accept Medicaid that have the specialty in the mental health challenges that need to be served. So we have a lot of young people that have experienced foster care that are experiencing post-traumatic stress disorder. And unfortunately, there are not a lot of therapists here in my state that do things like EMDR or different methodologies of therapy that are needed for the higher levels of trauma, because they don't accept Medicaid. And beyond that, as well as remembering that, you know, there are other ways of getting services. Sometimes our services are very westernized, and there are not a plethora of options. Maybe just that sitting down talk therapy is not going to be what's most beneficial to the young person. Maybe there's some PT needs. Maybe we need some mind-body connection being addressed before even coming to the talking and all of those other pieces. And some other just themes that I would add in here is maybe how is the family being integrated and supported? Like I mentioned before, are we ensuring that the family is being seen as a whole? Peer support, that started for me when I was 15, And that was what catapulted me into being even willing to participate in any type of service, whether that was a group therapy session or a recreational therapy group that I was a part of, or even sitting down with that one-on-one therapist, knowing there was other young adults doing that to guide through that, to support those community-based resources. I think we need to remember, in order to solve these problems, young people with lived experience have to be brought at the tables of decision making at every level, whether that's community, regional, state, federal levels. Do you have young folks checking in on the practice? Are you asking young people what they're getting out of it? Are you then, through that research of discussing with young people, are you changing your models to fit the youth and young people and the needs that are needing to be met? So I would really also add, again, that family first implementation is one that I've seen heavily, and it all worked and became what it was because of the lived experience that has led and guided it. In order to do it well, we need young people with lived experience. So I would say things like this and beyond just these panels, making sure that young people are implemented at every level possible.
Yeah, absolutely. And we are so unfortunately running rapidly out of time. So I do want to give each of you an option or an opportunity to, you're in a Zoom room, but a room with, all kinds of policymakers, staffers, everyone from every kind of mental health area that you can imagine. Each of you, I want to give you an opportunity. If you could tell lawmakers to work on or fix one policy issue, what would it be? And what do you want to see?
To hop in and just to be really, really brief, and give everyone else time to think. I think for me, the biggest thing is making sure that adolescent crisis intervention services and really youth-led crisis intervention programs are widely available. And I think one of the easiest ways of doing that is by creating a 988 subline staffed by teens for teens, right? I'm happy to share that Youthline, the organization that I volunteered for, had reached the lives of over 25,000 teens in 2021, de-escalated over 95% of high acuity contacts. So that's active suicidal ideation or the intent to harm oneself or others, and continues to experience annual increases of call volume of about 15% each year. And so we know that these programs work. And what I would really like to see is that you press, right now we know you press 1 and you're connected to the Veterans Crisis Line, 2 and you're connected to the Spanish Subnetwork, and 3 you're connected to a resource for LGBTQ people. What we would like to see is maybe you press 4 and you're connected to another trained teen if you want to, right? If you want to have the option too.
I'm very excited because today President Biden is announcing a proposed rule that will hold more insurance companies accountable for how they reimburse providers and their coverage of mental health, and kind of call them out on their very short networks sometimes. But I think that Congress can go further with this. I think that they can look at the president's proposed rule and make it, take it further in the sense of how do we make mental health more affordable? Seeing a mental health provider should not be more expensive than seeing a regular physician for primary care follow-up. And I think that offering at least the first 3 mental health sessions free would be the bare minimum that we could do to fix mental health accessibility for those on the ACA marketplace and private insured plans. So that's one of our many policy recommendations.
All right, well, I want to give Avery Pakulis just a minute to sort of walk us out in this last little bit of time we have left.
Thanks, Maddie. Hold on. Hi there, everybody. Avery Pakulis with First Focus on Children, and thanks, Maddie. Natalie and Amaris, I did want to just make sure you had the opportunity if you wanted to answer that last question, if you were so inclined. No problem if not, but did not want to cut you off. Well, I can't believe the hour is just about up. Oh, Natalie, go ahead. Sorry.
I would just like to echo everything my peers said and expanding access to alternative methods, remembering that just that one westernized method is not the only one. So expanding upon Biden's policies and holding your communities accountable to implementing peer-to-peer support in anywhere possible would be my recommendations. Thank you for holding that space.
Thanks so much, Natalie. And I want to just give a big thank you to all of our incredible panelists. That time just really flew by. Thank you for sharing your stories, your time, your space with us, and for all of you who tuned in to join the conversation. I am going to just rapid fire say a couple things that really stood out to me that I heard, that youth and children are paying attention. Youth can sometimes feel like adults don't believe in their ability to make change. There's something called generational stigma, and stigma transfers through those generations. Labeling is just destructive to young people. We need to level set mental health with physical health, avoid Band-Aid fixes, and challenge policymakers to think about how to embed youth in a process, not in a one-off situation, but in the entire process. So thank you all for that. We are going to First Focus on Children is going to follow up with all of our registrants to share a recording of this session, to share some of the policy recommendations that were discussed. And please stay in touch with us. We would love to hear from you, and we look forward to continuing our conversation on youth mental health. Thanks, everybody.